A coma is a state of prolonged unconsciousness in which a person is unresponsive to their environment, unable to wake up, and does not react to external stimuli, such as pain or light. It is considered a medical emergency and can result from a variety of causes, including severe brain injury, stroke, intoxication, or underlying medical conditions. Comas vary in severity and duration, and the likelihood of recovery depends on the underlying cause and the extent of brain damage. Causes of coma can result from a wide range of factors that disrupt normal brain function. Head trauma. Severe injury to the brain, such as from a car accident, fall, or blow to the head, can cause swelling, bleeding, or damage that leads to a coma. Stroke. A stroke occurs when the blood supply to the brain is interrupted, leading to brain tissue damage. Ischemic stroke caused by a blood clot and hemorrhagic stroke caused by bleeding can both lead to coma. Brain tumors. Tumors that grow in or near the brain can compress brain tissue, cause swelling, or increase pressure within the skull, potentially leading to unconsciousness. Lack of oxygen hypoxia. When the brain is deprived of oxygen for an extended period, such as during cardiac arrest, drowning, or suffocation, it can cause permanent damage and coma. This is called hypoxic or anoxic brain injury. Infections. Severe infections of the brain, such as encephalitis, inflammation of the brain, or meningitis, inflammation of the membrane surrounding the brain and spinal cord, can cause swelling that leads to coma. Seizures. Prolonged or repeated seizures, especially status epilepticus seizures lasting longer than 5 minutes, or recurrent seizures without regaining consciousness in between, can interfere with brain function and lead to coma. Metabolic imbalances. Imbalances in the body's chemistry, such as hypoglycemia, low blood sugar, hyperglycemia, high blood sugar, or electrolyte imbalances, e.g., low sodium levels, can disrupt brain activity and cause coma. Intoxication or poisoning. Overdoses of drugs, particularly alcohol, opioids, sedatives, or other central nervous system depressants, can lead to a loss of consciousness. Poisoning from toxic substances like carbon monoxide or certain chemicals can also cause coma. Liver or kidney failure. In advanced stages of liver or kidney failure, toxins that are normally removed from the body build up in the bloodstream, potentially causing brain dysfunction and coma. Diabetic coma. Both diabetic ketoacidosis caused by extremely high blood sugar levels and hypoglycemic coma due to very low blood sugar can lead to unconsciousness in individuals with diabetes. Severe hypothermia or hyperthermia. Extreme body temperatures, whether due to prolonged exposure to cold hypothermia or excessive heat hyperthermia or heat stroke, can impair brain function and lead to coma. Symptoms of coma. The person in a coma exhibits the following characteristics. Unresponsiveness. The individual cannot respond to sound, touch, or other forms of stimuli. Inability to wake up. The person cannot be awakened, even when stimulated. No voluntary movements. Reflexive movements such as withdrawing from pain may occur, but purposeful movements are absent. Abnormal breathing patterns. Depending on the cause of the coma, the person's breathing may be irregular or shallow. Lack of eye response. The eyes may remain closed, and the person does not respond to light or visual cues. Diagnosis. To diagnose the cause of a coma, healthcare professionals will conduct several tests to assess brain function and identify underlying issues. Physical examination. Doctors will examine the patient's reflexes, pupil response to light, and other neurological signs to gauge brain activity. The Glasgow-Coma scale (GCS) is commonly used to assess the level of consciousness based on eye, verbal, and motor responses. Imaging tests. CT scan or MRI. These imaging techniques can detect brain injuries, tumors, stroke, or other abnormalities that might cause a coma. EEG electroencephalogram. This test measures electrical activity in the brain and helps identify abnormal brain patterns, such as those caused by seizures. Blood tests. Blood tests can check for infections, metabolic imbalances e.g., blood sugar levels, drug or alcohol intoxication, and other conditions that might explain the loss of consciousness. Lumbar puncture. Spinal tap. In some cases, the lumbar puncture may be performed to test for infections or bleeding in the brain by analyzing cerebrospinal fluid. Treatment. Treatment of coma depends on the underlying cause and may include emergency stabilization. Initial care focuses on stabilizing vital functions, such as ensuring proper breathing and blood circulation. Intubation and mechanical ventilation may be necessary to maintain oxygen flow to the brain. Addressing the underlying cause. Surgery. If a brain injury, tumor, or hemorrhage is the cause, surgery may be required to relieve pressure on the brain or repair damage. Medications. Anticonvulsants may be used to control seizures, while antibiotics or antiviral medications may be prescribed for infections. Patients with metabolic imbalances e.g., low blood sugar may receive treatments such as intravenous glucose or insulin. Detoxification. For comas caused by drug overdose or poisoning, the administration of antidotes or the use of supportive care may be required. Supportive care. People in a coma require constant monitoring and supportive care, such as feeding through a tube, managing infections, and preventing complications like bed sores or blood clots. Prognosis and recovery. The prognosis for a person in a coma depends on several factors, including the cause of the coma, the duration, and the extent of brain damage. Recovery can range from full recovery to permanent vegetative state or death. Glasgow-Coma scale. The score on this scale helps doctors assess the severity of the coma. The lower score indicates a deeper coma and generally a worse prognosis. Duration of coma. The longer a person remains in a coma, the lower the likelihood of full recovery. Recovery is more likely in cases of coma caused by reversible conditions e.g., drug overdose than in cases involving severe brain injury or stroke. Rehabilitation. For those who emerge from a coma, rehabilitation may be necessary to regain physical, cognitive, and emotional abilities. This can involve physical therapy, occupational therapy, speech therapy, and counseling. Complications. Coma can lead to serious complications, especially if it is prolonged. Brain damage. Permanent cognitive or physical impairments may result from prolonged coma due to brain cell damage. Infections. People in comas are at risk of developing infections, such as pneumonia, due to prolonged immobility and the need for ventilation. Bed sores and muscle atrophy. Prolonged immobility can cause pressure sores and muscle wasting, requiring intensive care and rehabilitation. Conclusion: a coma is a serious medical condition that requires immediate intervention to stabilize the patient and determine the underlying cause. The prognosis depends on various factors, including the cause and the degree of brain injury, with outcomes ranging from full recovery to long-term disability or death.